Hi folks, welcome back to the Reading Room. I'm Ryan, and this is the series where we look at common radiographic cases in small animal practice to help you level up your radiology game. So this week we are talking about evaluating the lower urinary tract in male dogs. It's not uncommon that you're going to see a male dog present to your practice with evidence of either stranguria or maybe even other types of urinary presentations, hematuria, and we're going to need to look at those cases radiographically to see what might be going on. Radiographs are a hugely important part of our diagnostic tool set in those cases, and knowing what to look for and how to position our patients becomes a really valuable skill set. So let's dive into the case. This is the image that I gave again this week in our Weekend Rounds newsletter. So if you haven't signed up yet, hit weekend-rounds.beehive.com and check it out. This is where you can get early access to the cases and get a news roundup of everything to do in veterinary medicine every Sunday for free in your inbox. I have a huge amount of fun writing that, and we'd love to have you be part of that community as well. So in this case, we've got this bulldog presenting for stranguria, and these were one of the radiographs taken at the practice. So when we're looking at this image, there's a few things that can really jump out at us right away, right? The urinary bladder is quite large. There's some gas opacity centrally within it. And then if we look very carefully, we can actually identify the cause of the problem, which are these mineral opacity features in both the proximal and the distal urethra. And we're going to look at a little bit more detail on this. Now, the Weekends Rounds readers, they absolutely nailed this. We talked about whether or not this could be radiolucent calculi, prostatomegaly, urethral calculi, or a paraprostatic cyst. And the majority of our readers are identifying this as urethral calculi, which is awesome, and I love to see it. So let's look again at this radiograph. The important piece to note here is that the mineral opacities are actually superimposing other bones in this patient. Here we have them superimposing the ischia, and here we have them superimposing the os penis. And this creates a bit of a diagnostic challenge for us. If we're not carefully considering these radiographs and using some other types of projections, which we'll look at in a second, we can sometimes miss these findings. This patient has a lot of calculi in the urethra, and so it becomes a little bit easier to see. But you can imagine that only one or two, which might still cause an obstruction, could lead us to maybe not identify that as well. In terms of radiolucent calculi, my guess would be that folks were looking at these gas bubbles centrally and asserting that potentially those were radiolucent calculi. And what's important to remember about calculi that are technically radiolucent is that we actually shouldn't see anything at all. Because the soft tissue in the bladder is more opaque than those typically radiolucent calculi, we're not going to see them at all. And even now in some modern x-ray systems, what we typically used to refer to as radiolucent, the urate and the cystine stones, we're finding that we're actually seeing some of these more and more. So it's actually incredibly rare for us to identify a truly radiolucent calculus. So if we're seeing the gas opacity there, or something that is more lucent than the soft tissue of the bladder, that's an indication that it's gas in the bladder rather than a calculus. The projections that we can use to actually aid our interpretation are the flex leg lateral projection, or you might hear this called the butt shot. And the reason being is that we want to be looking at the penile urethra in these male dogs. In female dogs, it's not as big of a problem, but in the male dog, bringing these legs forward to superimpose the abdomen gives us this beautiful view of the urethra here. In this image on the left, the clinicians have actually done some work to retropulse some of those stones, so we can see some of them sitting in the urinary bladder as well as the gas that was there, but there remains some stones in the urethra along the length there, and still some superimposing the ischium. And in this instance, we've partially done a different projection in that we've actually brought one of the legs caudally, which has opened up visualization of the os penis, which is really nice. but it's made interpretation of this more proximal urethra here a little bit more challenging. So this is kind of the preferred shot to evaluate the entirety of the urethra in the male dog, and this is what we should be including in any male dog presenting for any lower urinary tract signs. In this instance, the clinicians actually also performed a retrograde cystourethrogram, and these are a couple images from that study. And one thing I just wanted to point out is that once we have a more opaque substance, in this case contrast medium, within the urethra, now all of a sudden those calculi, which were mineral opacity, are more loosened. And this is because of the relative opacity of the structures around it. So this is where they might look more similar to gas or filling defects, and these are the calculi persistent in the urethra at this level. So here we have kind of our first shot. We filled the urethra. We can see a number of these radiopaque stones as well as a large gas bubble, and the bladder is still pretty distended. And then an additional shot here, still some in the urethra. Now we're starting to get some of that contrast medium accumulate in the bladder and is outlining some of these calculi as filling defects at this point. So that's kind of what we might expect once we've added contrast medium into the picture for us to be able to actually see these as filling defects. Now, some folks had talked about this potentially being a paraprostatic cyst, and I think one thing that's important to note is that paraprostatic cysts can be associated with some dysuria in dogs, but what we typically see in these instances is that there is a mineralized rim or regions of stippled mineralization kind of adjacent to the urinary bladder. So because in this patient it was one big kind of uniformly soft tissue urinary bladder with a bit of gas, we wouldn't be as suspicious of a paraprostatic cyst. This is kind of a classic example of what it might look like. This is from Zekas et al. And what we can see here is this mineralized rim superimposing the bladder. And when we look in the VD projection, it's to the right, whereas the soft tissue bladder is here to the left. And there's a nice report that looks at kind of all of these findings, Renfrew et al. from 2008 in Veterinary Radiology and Ultrasound. If you wanted to read up a little bit more on that, it talks about the distribution of mineralization patterns. So I hope this has been helpful. The real key things to remember are using that flex leg lateral projection in all male dogs presenting for any lower urinary tract signs. That's going to really help us be able to evaluate those patients clinically and get the right answer. We'll see you again next week for another interesting case.